Dr. Ed Laskowski, thank you so much for being here.
Thanks so much, Ben. It's my pleasure.
We were really excited to do this one in the UK. The spring is coming around. The weather's a bit nicer, so we can actually get outside and exercise a bit more. My first question to you is, I think people know intuitively that exercise is medicine, but forget. And I'd love, over the course of our conversation, to try to reignite that why. Try to reignite those reasons for exercising and maybe dive into some of the mechanisms. So, first of all, how did you get to the conclusion that exercise is medicine?
Well, I've always been active in my life, Ben, and I was actually on the U.S. ski team when I was younger, and so exercise and physical activities has always been part of what I did. But it's interesting. On that ski team, we had some colleagues who had some ankle injuries and fractures that were, kind of fixed by the orthopedic surgeon. But then, I had one orthopedic surgeon tell one of my colleagues on the team, well, 90 or 10% of the job is done now after the surgery. And I'm like, what do you mean you fixed them? He's like, no. Now you got to do the exercise. Now you got to do the rehab. Now you got to get strong and better again. It's like, wow, yeah. So, and the more as I began to go to medical school and be in the medical field, we have a lot of shiny and flashy and very impressive technology now, which is great, and nothing against that. But sometimes I think we forget the foundations of how helpful physical activity is. And we do a lot. I work at Mayo Clinic in Rochester, Minnesota, and we do a fair amount of research. And what if I told you that there was a pill that reduced the death rate of breast cancer and the recurrence risk by half, that lowered the risk of colon cancer by 2/3, that reduced the risk of dementia, Alzheimer's, by about half, that reduced heart disease and blood pressure by about half, that lowered the risk of stroke by 1/3, that lowered the risk of type 2 diabetes, that's the diabetes we get when we get older, by about 2/3, and that decreased depression as effectively as Prozac or cognitive behavioral therapy. We'd be lined up around the block to get that, right? You'd pay whatever amount. And all those are evidence-based effects of exercise, physical activity. And so that's the power. So once you learn that, and these are all, again, voluminous amounts of evidence. There's not just one study that, it might show. These are thousands of studies that show the benefits of physical activity, so that when you look at that, you want to not forget the foundation. And in our technology intensive society, we have a lot of things that we inject and do to people, and again, we want to make sure we remember those foundations, because those are really effective. And this is, we think of, I'll just take a pill, and this is the pill. This is the pill to really keep us well.
It's amazing, because if that was a drug, that would be touching on $1 trillion drug,
Absolutely.
medical device, whatever it be. But
absolutely,
there is no drug that can hit half those boxes, even a quarter. So to even take note that a lot of this is even in our hands is quite refreshing for a lot of people.
Yes.
And I think that message needs to be honed, especially in a world where we're looking for the quick fix. We're looking for the quick pill. And actually, sometimes just doing the work is the shortcut, right? So shortcut in the long term. So all those profound benefits are amazing. Exercise is a pretty broad term. Now, that could include yoga, could include running, could include lifting weights, you name it. I'd love to go through a few different exercise modalities and just explore maybe some, not pros and cons, but some benefits, and maybe some things where you might have to compensate around. I'd love to start with sort of low and slow zone 2 training.
And that's a great point, Ben. I think one of the things that I think the word exercise, we like the term physical activity, because sometimes exercise implies that you're putting on spandex, going to a health club, sweating bullets, lifting 500 pounds, and it's no, you don't have to do that. And physical activity, anything you do, whether you ballroom dance, whether you walk, whether any movement is good. We say motion is lotion.
So spandex is optional.
Yeah,
Okay.
this is
All right.
definitely
All right.
optional. Right, right. Movement is medicine. So just moving our body. So, just simple play. And you think of kids playing, you don't have to be an organized sport. You play tag, you run around, you do stuff. Anything you do is helpful. And I think that's sometimes people think, oh, I have to run a marathon, or I have to be lifting these big time heavy weights. And no, really, our physical activity guidelines that we developed in the United States for Americans in 2008, and then they were revised in 2018. We looked at all the research out there, and the magic numbers are 150 minutes of moderate activity. So moderate is kind of like you're doing something, but you can kind of carry on a conversation. That level of activity, just that level of exertion, reaps tremendous health benefits and really cuts the risk of death and a lot of diseases, a lot of cancers, a lot of heart conditions, things, and type 2 diabetes, which is really rampant in our country especially. So it doesn't have to be. And again, walking is fine. You don't have to run. If you like to dance, that's fine. If you like to do yoga, that's fine. Tai Chi, very good movement-based therapy that also helps stability, which as we get older, falls are a big risk in the population. Over 65, it's the sixth leading cause of death is falling. So doing something that kind of promotes our stability, promotes our ability to prevent falls, those are all good things. So the low level activity, and some studies have found even just minimal amounts per week really helps. So we used to even have in our guidelines a cutoff of 10 minutes. Oh, you have to be doing 10 minutes to get benefit. And now it's not anything. You that old park the car further away when you shop, take the stairs instead of the elevator. All that adds up, and as we accumulate those minutes of movement in the day, we're going to reap the health benefits that we need. So and again, I think that turns a lot of people, when you first hear these numbers, I can't do that, or I can't run that. Well, you don't have to. Again, any movement is good movement.
I love that approach. I mean, very much people can be guilty of, okay, I'll go all in, I've got to run a marathon or an ultra or whatever it is, when actually it's the small things compounded over time which will probably make just as much difference. There's an old trick, I can't remember where I got the notion, some book somewhere, where every step you double step instead of single step. And it doesn't sound like much, but if you were to do that consistently through a lifetime, the difference in small physical activity would probably be stark. So I'm sticking with that one.
For sure. And Ben, you got to like it, because a lot of things, everybody's got a program, or everybody's got an ideal piece of exercise. You got to use the blank, you got to get the blank, and if you don't like the blank, you're not going to use the blank. So again, anything is good, and finding something that's enjoyable, that's you like to do, that's practical, that fits into your lifestyle. That's the key, because sometimes, and some people get energized if they go to a health club or fitness facility. That's great for them. They like the social aspect. They like to, that's the way they like, that's fine. But you don't have to. Some people don't like that. And anything is really good. And that opens it up. It doesn't, we don't have to have fancy equipment. We don't have to join an expensive health club if we don't want to. Anything will do.
It was nice that you're obviously not trying to sell anyone anything as well, which is really, really lovely message. I think there's so much, there's an absolute wave of material out there, and so much information bombarding, and you're not sure who's trying to sell you what and why you need this special device and this special program. And actually, it really does get into the basics of this intro level, move more, and how we fit it. If you park slightly further from where you work or whatever it is, that intro level baseline of exercise you just mentioned, of actually just start to move more, is wonderful. If someone takes that on board and, first month, they're just moving more, they're, as we said, parking further down the road between where they work, there, I don't know what it is, incorporating more walks after meals, what would be the next phase up from that? And, where would they go?
I think that as people do those things, they're going to find they can do more of those things. So the stairs are going to become easier. They're going to be able to walk longer distances, and you'll self-select. All of a sudden, that level that was moderate before, all of a sudden that'd be easy, and all of a sudden you're going to have to go a little faster to get that moderate level. So your body will respond to that. And that's the other good news. It's never too late to start. It really isn't. I've had tons of patients, doc, I'm done. It's too late for me. I can't change this. I say, yes, you can. No, you can. I can't. Yes, you can. No, back and forth. And, finally convince them. And, the life-changing effects are incredibly profound. I had one patient one time, he brought in his pants actually to show me he lost 250 pounds in about a year and a half. And he goes, he had me take a picture of him because he said, Doc, I didn't do anything fancy. I didn't join a fancy health club. I didn't, get a fancy exercise equipment. He said, I just did what you said. He said, I ate less and I did more. So it really does work over time.
Okay. How important is training volume versus training intensity?
Well, the guidelines for fitness respect that a little bit, the intensity part. So we have that one magic number of 150 minutes per week. So that's 30 minutes of moderate activity per week, or 75 of vigorous activity. So that's if we're doing something a little bit harder. So if we're really working, if we're really cranking on our walk, even just walking fast or cycling, 30 seconds, we really take it up hard as you can on the bike, or we're in the water, we're swimming, 30 seconds, you swim as hard as you can for those 30 seconds. That's called interval training. You may have heard the high intensity interval training, and that's as simple as what it is. It's really short periods of high intensity exercise and then a period of recovery for about 2 to 3 minutes. So 30 seconds of doing something hard as you can, and then a couple minutes of recovery to kind of let your body catch up. And our research shows that that's a very effective form of training. So it's incorporating that. It's more time efficient. People seem to like it. And even people with conditions and diseases like heart disease or obesity do really well with that type of training. And we find that there's no increased risk to them really of doing that type of training. Again, starting off slow and doing things that you're comfortable with are really important there. But but you don't have to. I mean, if somebody likes to just walk for 45 minutes, that is absolutely fine. And they don't have to do the interval training. But the interval training is one thing, if you throw into your program, is nice because it is quite efficient and, it packs a lot of bang for your buck. And we find that when we measure the physiologic parameters of what interval changing changes in us, it does a really nice job of changing some things like our lipid profile. It gets more of our good lipids and decreases the amount of the bad lipids. It does things to our metabolic profile. We become more sensitive to insulin. We have less risk of type 2 diabetes. So that type of training is actually very effective. But if somebody just likes the continuous moderate training, that's okay too. And some people may like to just, take a walk after dinner. They walk for an hour. They're doing really good things. And again, over time, what will happen is they'll probably be able to cover that distance or cover more distance in the same time, or they'll cover that same distance faster. So that, and we're not, don't want to, I mean, markers are nice, but just doing it, I think, and weaving activity into your lifestyle is the key. And like you said, our family used to, after dinner, we used to just all walk and talk about the day. Instead of sitting around the dinner table, we'd walk around the neighborhood and talk about, what happened. You can bike together, you can walk together, you can ski together, you can do, anything that you can do that kind of gets you out. And when you weave that in, like, because we did that with our daughters, now our daughters, that they always want activity. It's kind of part of who they are. So if they don't get activity, they don't feel as good. And again, we didn't force them. We didn't, what you're going to do this, that's just something we did as a fabric of what we did as a family. And, playing tag, playing those simple things, games that just get you moving, getting out there and just, running around, doing stuff, biking, that all is good.
So it's such a nice thing to do, that post-dinner walk. I mean, we do it quite often in our house, and I think it sets up for a good night's sleep. You end up digesting food a bit better. A lot of research around that.
Yeah.
And you just get those extra couple of steps in, right? I mean, I think life's better with a higher step count.
Yeah, right. No, it's a great point, Ben. And you made a point about sleep, which is very true as well. A lot of people have difficulty sleeping. When we're physically active on a regular basis, we find that the deep sleep, the deep restorative sleep, our stage 4 sleep actually improves. So once we improve that, that improves our lifestyle in general.
Okay, so with this pill, that we're taking, this exercise pill, it seems like the most important is just to take it, just to get some level of this in.
Exactly.
However, what would stop you taking this pill would be injuries. and being unable to exercise, right? So how important is the prevention and I guess mobility piece about sort of preventing any injuries and ailments to stop you actually exercising?
It's a great point, and how you move matters. And we found some things as far as how people move that correlate with injury. For example, you may have heard of anterior cruciate ligament injuries, the ACL injuries. Very common in sporting populations, especially sports that require cut pivot. So in your European football, in tennis, singles tennis, you can imagine with a large amount of court coverage. Those are sports in which you're at risk of an ACL tear. So we've found movement patterns that actually feed into that risk pattern. And one of those is when you do a single leg squat, your knee actually moves to the inside. So we actually screen kids for that. So in our city, before you go into high school sports, you need a screening physical. So we actually screen kids, and kids who have that, we give them exercises to correct that. And really, it's a lot of core stability and hip group muscle functioning, gluteal muscle functioning, so that knee does not fall inward. So foundational things are very important. So one thing we recommend, especially parents with their kids, if you're going to get a kid if they like golf, get them a golf lesson. Really start with a professional. If they're going to play tennis, get them with a tennis professional, because the technique, the way you do things matters. If you're going to throw a ball, learn to throw it right. And we find this even at the professional ranks. There'll be American baseball pitchers who may have a special pitch, and maybe it's very effective for a short period of time, because if it's outside that bell curve of normal mechanics, it puts excessive stress and strain on certain parts of the body, which eventually will break down and cause an injury. And say, oh, how'd you do that? Well, it wasn't one thing. It was a lot of things over time that added up, and bad technique, it matters. So if your kid's going to play a sport, really important, or really important to get that foundational, just how to do it right. We learn a lot from our friends and colleagues and things like that. But it's as you're starting, the movement is really important, and the way you move and how you move. So we use a lot of video analysis in sports medicine. So we'll actually, video you swinging a golf club. We'll video you running. We'll video you throwing a ball, and we'll break it down. Sometimes it helps to see that, because you see, oh yeah, oh, your elbow's dropping. Oh, you faced the plate too early, and now all that energy's in the ground instead of going to the ball. So those things are important, especially if you're considering a sport.
Definitely.
And if you're not, the simple things are, just walking and all that, that's great. But if you're going to more select activities, it's always nice to learn how to do them the best way possible.
You mentioned pitchers in baseball. I mean, we don't.
Mhm.
It's like Quidditch to us in the UK. We don't know what's
Yeah.
going on. But I was reading an article ages ago that it's really common that they blow the shoulders out really early, and most
Yeah.
of them have sort of shoulder stabilization operations and all of this.
Well, even in cricket, right? There's a right way to do it, right? And if
For sure.
you start, that energy has to be, we call it the movement chain, the kinetic chain of movement. And you have to transfer the energy from the ground through the body, and in a smooth fashion. And if somebody has a special little quirk or a little, hitch in what they're doing, all of a sudden that person's going to be at risk. And all of a sudden they may have problems later on in a certain area because of the way they were moving or the way they were throwing.
Yeah, 100%. I mean, when I was in my sort of late teens, early 20s, everyone older than me was like, "Look, you gotta warm up, you gotta stretch properly, because when you get older, you're gonna feel it." And obviously, just don't worry about that. I'll be fine. And inevitably, I've got to my late 20s and think, oh my gosh, there's got to be some buy-in now before every exercise. Like, I've got to earn the right to do this. And rehab routines have hit me hard. And so far so good, but it's that trajectory I'm on. I don't want to stay off through
Right.
some injury or bad mobility. I'm
Right.
aware we're fighting against entropy in various different forms. From a cardiovascular point of view, there's a certain, correct me if I'm wrong, but there's a certain amount of decline every decade, and the same with muscle mass.
Mhm.
I'd love if you could just sort of tell us more about that, I guess,
Sure.
and the
No,
decline and what we can do.
it's a great point, Ben. Because really, we've been talking a lot about the heart health and cardiovascular fitness, but the main components of fitness, the classic triad that you hear about, the three components are your heart health, your aerobic fitness, strength, and flexibility. But I throw one more in there, stability. Because you can be very strong but not stable. You could be very flexible but not stable. You could be very cardiovascularly fit but not stable. So those are the kind of the elements that we want to incorporate into our routine. As you pointed out, we lose about 10% of our lean muscle mass per decade after age 30. So as you can imagine, as you get older, 40, 50, 60 years old, that's a significant amount of muscle mass that we lose. And what is that replaced by? It's replaced by fat. Now, the good news is our physiology changes. That's true. Our basal metabolic rate, the rate which we burn calories and all that, changes as we get older. The elasticity of our connective tissue changes. We get more stiff. But we can mitigate all those effects if we start putting in exercise activity, physical activity to correct that. So strength training is really important. And if we strength train, we can mitigate all that loss of lean muscle mass and we can restore that. And again, you're never too late. Until you breathe your last breath, you can always benefit from strength training. They did one study of 86 to 96-year-old individuals in a kind of a long-term care facility, and they put them on a strength program. The average strength gain was 174% average. Some gained over 300% in strength. And what did that mean? Well, these people now could get up out of chairs they couldn't get up from before. They could cross the street before the light turned red. It changed their quality of life. So strength training is huge. Flexibility, you may hear some controversy about that. Oh, should we stretch? Or is it good? Oh, don't stretch before an event. And some of the controversy came, there was a study that showed that if you did a ballistic sport activity like a high jump or long jump, and you did a static stretch right before that activity, it may cause maybe about a 10% decrement in performance. That's kind of where that came from. Instead of flexibility, I like to use the term range of motion about a joint. You should have the optimal range of motion about your joints so the muscles function most effectively. So if we don't have that motion, then we can have some problems. So say your hamstring's a muscle in the back of your thigh. And runners sometimes, I strained my hamstring, or get a hamstring pull or hamstring strain. Well, that may cause a little bit of muscle tightness. And if we do testing of the hamstring, the flexibility, we may find that one side that was injured is a little tighter than the other side. Well, you magnify that by going back and running again. And all of a sudden, 7 months later, oh man, it's killing me on this. Well, what'd you do different? Nothing. Well, that imbalance over time overloaded that muscle group, and now we got an irritation muscle, a hamstring tendinopathy maybe, or a hamstring strain. So it's important to have equal range of motion about the joint. So in that case, we really want the hamstring to be the same length on both sides. So stretching is important. Isolated hamstring stretching would be effective. So you really want to make sure that, especially in an area of previous injury, that you've kind of got the full range of motion back about that joint, and the full ability of that muscle to go to its entire length, and also the strength of the muscle too. So those things are very important. And then the last thing, that stability thing, that's as simple as really stand on one leg and just training the muscles to work together. I had a American football linebacker in my office. The guy weighed, 280 pounds. The guy could bench press about 550 pounds with a bench behind his back. But this guy stood on one leg. I could push him over with a finger. He was very strong, but he wasn't stable. He wasn't using his muscles together to stabilize the joint. We find this a lot. You may hear one of the most common sports injuries is an ankle sprain. You turn your ankle in. And we did some studies on that. We found that when you do that, you kind of disrupt the pathway of the ligaments and all that in the ankle to transmit information. So unless you correct that, you have another sprain, and then another sprain, and then another sprain. So we actually put these people who sprained ankles, we have them do simple single leg stand stuff. You may have seen something called a Bosu ball in the gym. It's kind of like a stability ball that you stand on. The more you do those types of things, you train your muscles to work together. And that's what prevents falls. That's what increases stability. That's why even in an older person, again, it doesn't have to be dramatic. You can do Tai Chi, which is a very gentle movement-based form. And that has been shown to reduce the risk of falls and hip fractures, just participation in a Tai Chi class. So kind of, having those four components in, you get your walk in, you get your cardiovascular fitness in, you do your strength training for major muscle groups to make sure we get our lean muscle mass where it should be. You have flexibility, you have range of motion about the joint. You have make sure that, especially in an area of previous injury, you restore the length of the muscle. And then you do some stability stuff. And again, it can start out simple. You're brushing your teeth at night. You do it on one leg. You're doing your biceps curls. You do them on one leg. That trains core stability as well. So you really want to train in what we call a functional manner, the way in which we use our body in life or in sport.
I love that. I think, again, of just bringing it back to that why of, okay, there's this magical pill called exercise, which has all these downstream effects if you can do it, but you
Yes.
don't get to have any of those benefits unless you can actually participate. Stability. So yeah, it was such a great point, because I think it's definitely a blind spot for, well, me, and I assume many other listeners as well. What is it you do? I'd love to know how you know the research so well. How do you actually implement all of this?
Great question, Ben. And I do all the simple stuff. So I do a lot of one leg things. So if I'm doing my biceps curls to, strengthen my biceps, I'll do it on one leg. So as I'm working that, and that's how we kind of live life. We pick up things, pick up heavy objects, bend down into trunks, things like that. So what I'll do is I'll try and train my body to work in the way it does in life or in sport. So say I'm doing a bicep curl, I'll stand on one leg to do that. So now my core is activated so that I'm stabilizing my core so that I can do my biceps curls with appropriate technique. And I'm also challenging the stability system. And I do a lot of, simple stuff. You're brushing your teeth, brush on one leg. And there's been some amazing studies that show that your ability to stand on one leg for about 20 seconds really predicts your mortality, your death rate. Simple things like that. And so it's just getting the muscles to work together. Now, somebody's just starting out, you want to start with a stable surface nearby. And again, you can just hold on with your hands initially. That's fine. But the more you do that, the better you'll get. And all of a sudden you'll find out, oh, I don't have to hold on with my hands. And oh, I can stand longer on one leg. And oh, I can add an additional challenge. Maybe I'll get an uneven surface like a foam square, or maybe a Bosu ball, a stability ball. And the higher level you go, the higher you challenge. It's just like anything. Strength training, we challenge the muscle with resistance so that it adapts and gets better. Well, if we challenge stability, stability adapts and gets better.
Mm.
So a lot of it can be really simple. So those are the things I do. I do strength training with free weights usually, because I think that's something I don't go to a health club. I just do all the stuff at home. So I have some weights at home that I do. And again, we weave that physical activity. I like to walk a lot. I like to hike. I like to bike, so kind of do those types of things. So, and just, weaving it in again, just weaving it into life. So you have some minutes during the lunch hour to take a walk. You have some minutes, like you said, at night. I like to do stuff right after work because it kind of gets the tension of the workday gone and sets you up for the evening nice, and like you said, Ben, it kind of contributes to that restorative sleep at night too. Sometimes you don't want to exercise too close to bed because then it might actually keep you awake. But I like the after work time because it does a nice job of doing both of those things. It kind of gets us the tension of the day gone and sets us up for a nice energetic evening as well.
Me too, 100%. Maybe not the high intensity stuff too close. I agree. With just going back to muscle mass and the muscle mass decline, I know protein synthesis, or the ability to use proteins and build muscle tissue, decreases with age. How important is maintaining an adequate protein intake into middle and older age?
It's a great question, Ben. I think, I think the diets that we have are pretty, if we just stick to the basics, again, foundational things. So, vegetable, fruit dominant with lean meats and proteins, I mean, I deal with professional athletes all the time. There is no magic supplement. There is no magic pill. There is no magic bullet for that. I think if we have that habit of clean eating and just doing those types of things, I think that'll take care of itself. Really, to get protein deficient and all these protein powders and drinks and stuff like that, basically, we just kind of excrete them back out our body again because our body is really getting it enough from our foodstuffs. And if you're getting into a hobby, oh, I'm bodybuilding, and okay, all right, then get you more chicken and more lean meats and protein. That's fine. I'd rather get it through foodstuffs though than through pills or supplements. There's something we call bioavailability, the ability of your body to process what you ingest in, and it's always better to eat chicken for protein than to eat protein powder or drink a protein shake. It's our body uses it better, and it's just healthier for us. So as long as we're doing the basics as far as clean eating, and again, there's no magic there. Just like with activity, it's just really the vegetable and fruit dominant and lean meat and protein. There's nothing that has supplanted that, and we don't have to worry about taking, unless you have a specific medical condition. Okay, you need a specific supplement, but as long as we're getting those basics and eating right regularly, and again, clean eating. Can you have a piece of chocolate cake once in a while? Absolutely, but maybe not every night or with every meal. So as long as we're doing those foundational things and we're characterized by doing making the right choices, it's going to make a difference.
Okay, lovely. You mentioned professional athletes. What have you learned from your time working with professional athletes, and what can we learn from them?
Well, and really, it is a message of hope and encouragement because just what I said, they don't do anything magic. They just do everything. They do the foundational things very well, and they do you look at the greatest athletes in their sport, their sound, what they do, the golf swing of Tiger Woods. He's always working. Oh, I got to get my swing, got to get my swing back. It's that foundational thing that's so important. So whatever you do, if you have that foundation, the technique of the way you do things right, that's one of the most important things. And then it's just perseverance, it's dedication. Those will overcome raw talent all the time. I talk to coaches of major teams, and they said, I'd much rather have an athlete that's coachable, that works hard, than the athlete that is, his talent is way off the charts, but is none of those other qualities. So the basics work very well, and if we just do them, I mean, you got to be persistent, you got to be dedicated, you got to be passionate about it, you got to be a student of the game that you're playing, and you look at Michael Jordan, you look at all the greats in all the sports, they were very incredible students of the game, and even in American football, you see on the sidelines, the quarterbacks that really see the field, they know who's out there, they know the defense, they know alignments, they have a passion for the game, a passion for winning, and a passion for doing the right thing with their body. So these are the athletes who really do. And you look at a lot of sports like golf, like you think of 20 years ago, golfers look totally different now, right? Since Tiger, they're doing strength training, they're doing aerobic conditioning. So they're, at the last round of the Masters, 4 days, they're strong. They're not, their endurance is way up there, but they have to work at that. And, again, golfers now compared to golfers, 20, 30 years ago, totally different body habitus. Same thing with our baseball players, our pitchers, and look at the performance increments we're seeing in those areas. So I think doing the basics well and having that dedication, that passion for what you do, and nothing can replace that. And those are the athletes that usually will succeed. They take adversity and they turn it around to something good. They use it, they learn, and they just are consistent. What is that saying? 90% is showing up. They show up. They're showing up all the time. They're making adjustments. They may lose, and how many teams in any sport you can think of, you have that story of how they were not that great, and then they started getting better, and they started doing the right things, and that led to them being where they are now.
I love your message, Ed, because it seems to go, as someone who's so accomplished and has spent so many years studying this, it seems to follow the progression that happens with, you go into a field and you realize, oh, this is easy, just it's the basics, and then you go into it and you realize, oh my gosh, I know nothing, and we
Yeah.
get overwhelmed with the complexity of things. And it's about maintaining my elite VO2 max and, I don't know, maintaining adequate ATP ratios through creatine or whatever it is, ice baths, everything. And then actually you go back the other side and you go back to the basics of you got to move more and be consistent with it and try to avoid injuries so you can actually do it for a long time, which is a wonderful message.
It's a great point, Ben. And you know, it's funny when you go, like, say you're a golfer, and you go to a golf professional for, again, I want to learn that. You think he's going to have some esoteric thing that's really high, and he goes, you know, where's your hand position? Where's your foot placement? Where's your? He always goes back to the basics, in anything. So it's
Mm,
a great message because the basics done well are what wins and what's
yeah.
effective.
Well, you said 90% of it is showing up. So it seems to be this whole exercise is medicine piece. It's just to show up in whatever way you enjoy, right? And to
Absolutely.
maintain and consistently do that. Um, I would love to touch on the sort of slightly more, I guess, perhaps sciencey stuff. So how important is VO2 max, for example? Do people even need to consider that? Or is it actually just, hey, make sure you're getting your step count up?
I mean, those are markers and they're measurements and they're good. And depending on what your goals are and what your field of, participation is, they're helpful indicators. So it's a measure of how we use oxygen and how usually for the endurance sports, like a cross country skier, skiing 50 kilometers, a marathon runner, they will have VO2 maxes that are off the charts. And they utilize and metabolize oxygen very efficiently. Their body uses it very well, and it is an indicator of fitness and performance. But again, I don't think the average person has to be that concerned about it because if we do the basic things, that will improve. And it's just the same thing about activity trackers. Are they magic wearing an activity tracker? No, but if it helps you, oh, you know what, I really haven't been moving much, and we're finding too, sitting time is an independent risk factor too for bad things happening in our body. So even if we do those minutes of activity, if we sit for 8 hours a day, the other times that's not a good thing. So kind of reminders to move, things like that, that's very helpful. But is it magic, or do we have to be in that? I'm so concerned about that target zone. Your body knows the target zone. When you're in that level where you're, exercising at that level, but you're at that level. And if you ever take a treadmill test, they'll have these scales. Say, well, how hard are you working? They'll be easy, and then moderately hard, very hard. You can put a 0 on those numbers. It's almost correlates with your heart rate. So your body knows where you want to be. So again, making it really simple, making it really foundational. If you do those things, you're gonna improve your VO2 max, and you don't have to necessarily know the number. They're nice for our research. They're nice for looking at these incredible elite endurance athlete performances, and we get these incredible measurements of VO2 max. But the average person can be very healthy and can improve their quality of life and quantity of life, without having a VO2 max measurement or without really focusing on that aspect of their cardiovascular training.
Okay, that's probably quite refreshing to hear for a lot of the listeners, I think.
Mhm.
When it comes to being aerobically fit, is that a given? If you've been fit before, is that cool? I've done the work. I'm sweet now, or how do you think about that?
Well, consistency is key. So we find that in anything, we really have to keep doing the things that get us that benefit. So if we can't say, oh, I got, oh, the perfect, I got, oh, exactly where I want to be as far as my muscle mass and oh, yeah, I'm doing that. And then we stop doing them. We say, okay, I'm there now. We stop doing them, we're going to regress, and we have to be consistent. So that's why I think it's important to weave these activities into your life, make them real practical, make them real easy for you to do. And there's a lot of barriers to exercise that people state too when they see us in the office, and so we want to kind of again dispel those myths of you have to be doing these high power things at a health club or a sport. Or no, you just have to weave these into what you do. So if you like to do weight training, if you like using your body weight, yeah, you can do that. If you like tubing or resistance bands, yeah, you can do that. You can take them anywhere too. If you like free weights, nothing wrong with that. If you like machines, okay. So there's a bunch of, you like pool exercise, water aerobics, and using weights in the water. And maybe you have arthritis, or maybe you have a joint condition. And that's the other thing too. no matter what your condition, we pretty much can find a way for you to get the activity that you need. So if you have arthritis, say in your knees or hips, well, maybe you want to do a low impact thing, a low impact exercise, maybe water exercise, maybe even water walking. If you don't like to swim, just walk in the pool, get the water about up to chest level, walk in the pool. The buoyancy of the water takes the pressure off your joints, and you can get activity and movement. So no matter what you have, there's probably a way we can get you what you need to do.
Mm.
But I think the practicality and weaving it in is really key, and not there is no one mold that, and in America we have some moms come up to doc, my kids, I don't they're not safe outside. I feel okay. That's a very real concern. We got to find a way around that. There's Dance Revolution. There's games you can play. There's a whole mess of things. We can use technology and combine that with movement. There's a whole mess of things that we can do to get that movement in and make it enjoyable and make it practical. Because if you don't like what you're doing, you're not going to do it. And there's a bunch of stationary bikes and Nordic skiers and everything that are coat racks because nobody's using them. It really has to fit with what you like to do and what's practical for you to do.
So true. It's so true. I think most people, have a 9 to 5, right? They're in the office, and the modern day lifestyle is quite sedentary. And there's so much research about how that's a really harmful state to be in.
Yeah.
You're not moving, and actually all these things I think sometimes a really good motivator is the why behind the need to do this, but also actually what goes wrong if you don't.
Yeah.
I'd love your 2 cents on sort of the obvious, well, maybe not, maybe less so obvious things that occur when you don't move lots.
Well, again, what our bodies do change as we get older. So they do. Our metabolism, our ability to burn calories changes. So if we don't do something to mitigate against that, we're going to gain weight. And when we gain weight, we put more pressure on our joints. There's a ratio. If we gain 1 pound in the midsection, that's about 4 to 5 pounds in our hips and knees, our joints and our lower extremities, just because of lever arm forces and all that stuff. So so now all of a sudden we got some knee pain, or we got some hip pain, or we're increasing the risk for arthritis. Our hearts, our bodies need to move. Our hearts need to be strong. Our heart is a muscle like any other muscle, and if it's not used, it doesn't get as in good shape. So we're more susceptible to diseases and heart disease. We talked about the eating aspect. Again, if we don't eat right, then that's going to impact what we do to our bodies and how our hearts handle those things and what it does to our heart system. So by not getting that movement, we're increasing the risk of bad things happening in our body, usually cardiovascular disease, heart disease, stroke. You may have heard of the hardening of the arteries, that plaque and bad substances can build up in our arteries that decrease blood flow, and eventually they can close down. We can get a stroke. That damages part of the brain. Heart disease, our arteries in the heart can clog up. All those things are muscle. We won't be able to do as much. We talk about quality as well as quantity of life, and I think that's very important, because we want to live long, but we want to live long in a way that's very enjoyable and gives us good quality of life, so we can do things that we want to do. And if we don't do the strength training, maybe, oh man, I can't get up from these chairs, or I can't lift that, or I tried to lift that, my back went out, and so it's going to affect our quality of life. And so to have the best quality of life and quantity of life, that's what physical activity combats against. We're made to move. Motion is lotion, and movement is medicine. So the more we can do those things, I think we'll have a longer life. We'll protect against heart disease, cancers. You may not think of that, but cancer, about 13 separate cancers, by that 150 minutes a week, 13 separate cancers are decreased. So tremendous, cancer risk is high. So how to mitigate against that? Well, physical activity is a way to do that. Risk of diabetes as we get older, adult onset diabetes, that's high. How do we do that? Well, physical activity mitigates against that. Our risk of heart disease increases as we get older. Physical activity mitigates against that. Our joints get stiffer. Our connective tissue gets less elastic. Physical activity, a little bit of range of motion and stretching helps against that. We lose muscle mass as we get older. We can't do as much. We can't do these tasks we used to do. strength training. Now we can do it again. So it really, it's not just quantity, but quality of life that this impacts on.
Love that. I absolutely love hearing that. So there's a minimum effective dose of 150 minutes of aerobic activity per week, or a 70-minute, slightly higher intensity sort of threshold. Is it dose dependent? If people want to dip their toe in and do a little bit more, they're a bit greedy. If you pushed it up to 200, 250 minutes, if they had the time and the ambition, is that better, or what are your thoughts?
That's great. That's a great question. And you know what? Those are our hallmark numbers, the 150 and then the 75 of vigorous. But we actually say 300 minutes of moderate and 150 of vigorous if you're trying to lose weight or if you have lost weight and you're trying to maintain weight loss. So that does bump it up a little bit. So then it's basically 300 minutes would be an hour, 5 days a week, or the 150 minutes of vigorous activity per week. So yeah, more is going to get you additional health benefit and fitness benefit, cardiac protection, all that sort of stuff. So but again, just to kind of have that sweet spot, you don't have to run marathons. And it's interesting. I teach some marathon training classes, and after a marathon, that's what we call a super maximal event. It means your body really is doing all it can for that time period. It's a very taxing event in the body. When we look at immunologic markers, we're actually more susceptible to like colds and infections in that about that 4 week period after a marathon because we've really extended our body. And it takes a little while. I'll tell our marathoners, yeah, kind of, rest up for, a few weeks afterwards and, just kind of take it easy, get recovery in. So very important. But if we have that sweet spot, if we're doing that moderate intensity regularly, then that's the highest risk of immunosurveillance. So it's our immune system is tuned up as good as it can be, the lowest risk of infection.
Mm.
So that sweet spot is very beneficial.
Do you think the mechanism behind that is cortisol based?
There's a lot of things in the body that change. So it's our ability our immune cells. We have cells that actually attack, bad things that come into our body, foreign substances, and T helper cells, killer cells, all those things that help us in our immune system. They're upregulated when we do physical activity. They're like on guard. They're like ready to tackle. So a fit person will get less. Even COVID. We've done some studies with COVID that people who are physically active had much less risk of severe COVID disease. Much less risk, and they recovered quicker. So again, that our body's in this heightened state of everything's working as good as it can, and when we get exposed to an infection or whatever, we're going to have the best chance of fighting it off because that immune system is already really prepared. It's the SWAT, the SEAL team of our body there.
Love that. I mean, there's so many benefits. I mean, you can go to PubMed and type in exercise and just get on all these different rabbit holes of how exercise can benefit you. With regards to research and literature, what are you most excited about over the next 10 years of finding out more in this space? And then I'd love to touch on sort of perverse incentives around drug companies trying to push a pill or something versus funding going into more I guess, accessible means?
Well, it's a great question, Ben. And you know what? I have served in two previous administrations under Presidents George W. Bush and Obama on the President's Council on Physical Fitness here in the United States. And it's sad to say, you say about the future, it's sad to say we haven't made any difference in obesity and sedentary lifestyle, and we're actually getting worse throughout the world. In countries that have never seen obesity before are seeing it now. In China, up to 25% of industrialized cities are seeing obesity as a problem. They're getting more access to technology, sedentary lifestyle. They're not walking as much, not biking as much, more cars, more, there's a myriad of factors that play into this. But worldwide, it's really still it's an epidemic. I mean, if we really look at and BMI is not a perfect number. You can be very fit and have a higher BMI. Nobody's advocating for a perfect BMI all the time. But BMI indicates how populations are doing. And if you look generationally in the United States and also every country, just in the past 30, 40 years, there's been an incredible increase in the amount of obesity and sedentary lifestyle. And again, it's not body shaming. These are things that really impact our physical health. They increase the risk of heart disease. Our joints are at risk. We have more joint problems. We have more type 2 diabetes. Huge health factors. So the next 10 years, instead of some incredible technology, and we got some great stuff in AI now. I still fight for the basics, the foundations. We still got to get that. In my field, and you're probably aware of regenerative medicine, right? We call it. Uh, it's actually a misnomer because it doesn't regenerate anything. I like to call it orthobiologics. It's our biologic substance injected to our joints. So that's you may have heard of platelet-rich plasma or stem cell therapy, things like that. And it's funny at Mayo Clinic we do incredible research. We're looking at this, but I tell my colleagues if you look at the effect size, and the effect size means a large effect size means that a research finding has significant practical significance. A small effect size indicates limited practical applications. If you took the effect size of all the studies on physical activity compared to the effect size of all the studies on regenerative medicine, the effect of physical activity is 800 times that of regenerative medicine. 800 times. And physical activity actually, when you mechanically active, you mechanically change immature stem cells into lean tissue instead of fat cells. That's truly regenerative. Nothing we can squirt in you or put in you does that. And there's a big emphasis now on everybody wants a quick fix. Squirt me, doc, or give me this and give me, and nothing has supplanted the basics. So really, the future is actually getting back to those basics and hopefully trying to change this really epidemic, this worldwide epidemic that we're having right now. I speak in all these countries. I speak in Czechoslovakia, which has a high rate, Australia, the United Kingdom. I mean, every industrialized country and many non-industrialized. In fact, the World Health Organization now says that there are more overfed than underfed people in the world today. Again, striking. And again, not that there's not underfed and we know all the problems, but in general, we're tending toward that other side. And again, if this were a virus or something, we'd be running in the streets because it's ubiquitous, it's everywhere, and it's having a huge effect on quality of life and mortality. So I look forward to hopefully making a difference in that, getting people back to these foundations and getting people back to the things that will, again, improve that magic pill that we talk about that is in our midst. It's free. You don't have to pay anything for it. It's out there. Everybody can access it. And so hopefully we get that message again. I lecture a lot of these, so I appreciate you guys even in focusing on this and having this as an emphasis because it's so important, and it's so important in so many ways. So I look forward to getting back in that. The technology is great, AI, super. There's great uses for it, but there's nothing that supplants the basics. And say your BMI and the striking figures. If you have, this is again just BMI, again not perfect, but if you have a BMI of over 30, you have a 200 to 300% higher mortality rate, which is death rate, than a normal BMI person. If you have a BMI of 25 to 29, which is kind of overweight, you have a 20 to 40% higher mortality. When I lecture at conferences, it's pin drop silent when I say that, because if we had a virus that did that, we'd be running in the streets. This is crazy, But so it's a significant factor, and it's certain racial and ethnic groups more of a factor. There's 20 years of life loss in certain racial and ethnic groups due to obesity and sedentary lifestyle. So these are foundational things that we have to make a difference in. And hopefully in the future we can start going back. And the problem with exercise, there's a lot of tradition in exercise, and tradition dies hard, and everybody doing what Arnold does or no, you don't have to do that. And our science now has shown, what we need to do and how we can do it and how we can get that benefit. And I think a lot of things that demotivated people, like, oh, I can't run that fast. I can't run that far. I can't lift that much. I don't want to lift that much. You don't have to. You don't have to. It's really these foundational basics that really add up over time and contribute to benefit. So kind of busting those tradition myths. We have actually on mayoclinic.org, that's our website to the world. And the reason I mention that, if you mayoclinic.org, if you just search strength training videos, we have 35 videos there using your body weight, using free weights, using tubing, using machines. You don't have to log in, you don't have to have a password. There's no charge. We use them for patient education to teach people how to do stuff right, because technique is really important in weight training. And I see a lot of people hurt themselves weight training because they're doing it wrong. They have bad technique. They're doing it with not good form and motion. So we show you how to do it right. We have a stretching slideshow. If you just search stretching, you'll get a stretching slideshow. We have a core. Everybody talks about core. We have a core slideshow. So all this is information that is out there for you. And we really, again, want you to get the activity right, and the accuracy of the activity. And that's used to frustrate me most in my practice, that 50% of my sports medicine practice was people playing sports and getting hurt because they're playing at the extreme of sport, and that's stuff happens. But 50% of people I saw, they got hurt by doing exercise, and a lot of times their trainers were telling them to do things they really shouldn't have been doing, and they weren't prepared to do, or they were doing on top of bad movement patterns. We talked about that inward movement of the knee. You start loading people up with that inward movement of the knee, things are going to happen, and not good things. So, we really want you to have the right technique and the right form, right mechanics when you do things. So we certainly show people how to do that. And education that's the key too of doing it right, and these basic things, but doing these basic things with good foundational principles and good technique. So if we can do that, if we can make a difference, if we can kind of combat the myths and the misconceptions and the tradition, everybody's got a program out there, right? You mentioned it's like, oh, I have a plan, or do this or do that. Nothing has supplanted and again, we talked about those elite athletes. They don't do anything, Matt. They do the basics well. They do what they need to do for their sport. They do it over and over again. They work on mastery. They work on doing it perfect. It's not practice that makes perfect. It's perfect practice. So you want perfect practice over and over again. Those are going to be your champions. So, in the future, it's a lot of back to basics and back to the future, I guess.
I completely agree. I think there's this pull back towards being more human, as opposed to this push forward to everything is tech, everything is online, everything is AI. And I think I'd actually love to, I'd love someone to study attention spans and exercise habits. I think as attention spans decline, sticking with something declines as well. And so, this isn't working, on to the next thing. I'll try this one, not working, on to the next one. And actually, it's just, as I guess, one of the principal messages from my conversation with you, which has been really, really fascinating, is 90% is just showing up.
Yep, exactly. Just doing the basics well regularly, and that's you really can't beat that too much. And really just thinking too. A lot of the trainer. Well, why are you giving them that exercise? Why are you having your 78-year-old grandma do burpees? It's like, and maybe if that 78-year-old grandma is in a master's track competition and wants to get more vertical, okay. But otherwise, you want the highest benefit for the lowest risk. And a lot of stuff looks good and it's shiny and it's glamorous, but the basic stuff works, and it'll make you tone, it'll make you fit, it'll make you look good, it'll help you lose weight. Another thing of strength training, we increase lean muscle mass. Guess what? We burn more calories, we help weight loss. So all those basic things work. And so it's kind of combating some of the entrepreneurial stuff out there and the programmatic stuff, and getting people to think and getting back to these basic foundations.
100%, 100%. Well, I couldn't say that any better. Dr. Laskowski, it's been really, really fun. I've really enjoyed the conversation. Where can we find out? Where can we follow along? Where can we find you?
So I'm on Twitter, so at Dr. Ed Sports Med. So you can find me there on Twitter. I try and push out on my X now, I guess we call it, but X, I try and push out research articles. So instead of the social, I really, if there's here's another article that shows how good walking is. Here's another article that shows how exercise improves our mental health, which we talked about a little bit, but that's huge right now. We have in the United States, highest risk of suicide, opioid addiction, alcoholism we've ever had. Alcohol combats physical activity combats all those things as well. So, right. I need a once in a while a cocktail, but
Yeah, yeah, exactly. It's a tipple or a beer definitely is nicer after a long run, right? I mean, there's the mechanisms behind the mental health side are interesting. I mean, rise and brain-derived neurotrophic
yeah,
factor are really cool, but then the psychological factor of I've taken myself out, I've done something challenging, and challenge is good. I mean, I think our ancient systems reward a challenge. I,
yeah.
I mean, we touch on this podcast a little bit, but almost this comfort crisis. We're too comfortable, right? And comfort doesn't lead to fulfillment. And I think fulfillment's the sort of indirect path to like a happy life. But
Right.
um,
And we're connected, mind body's connected. And that's one of the things like anxiety. It's when there's like late phase and then there's immediate phase. If you're anxious and you walk for 30 minutes, immediately it improves that anxiety immediately. So we're made to we're designed to move and our psyche is improved by it as well as our physical body. And and depression is very again, our world's crazy right now, and our kids growing up, and with the influence on technology and social media and all that, it's going to be really important to get them grounded in movement and activity to get those beneficial effects for their bodies. So they have more increased bone health, so they have less depression risk, so their mood state, their sleep improves, their and social connectedness improves, all that type of thing. So it's really a a many faceted problem that affects many things.
it's almost too simple. You know,
Yeah,
it's almost like, well, cool, give me the pill. Oh, the what's the thing in America kicking off at the middle? Or Zempic. Am I pronouncing that right?
yeah, yeah.
I
It
mean,
makes you so nauseous you don't want to eat anything.
oh god,
That's right.
it sounds like a very slippery slope. I mean, by all accounts, I thought I mentioned, so we've probably got to go there. But it's is it an injection?
A pill, but
It's a
it's I
pill,
mean
right?
there's in various forms that are injectable too, but all these again, there's no magic pill. So the sustained duration, we don't have any long-term data on these two as far as even the weight loss that occurs, how well it's kept off. And you all know the saying, diets don't work. Clean eating works. It's a habit, a lifestyle that you incorporate, not a temporary intervention of something that causes a change. It has to be sustainable over time.
Mm.
And any pill has side effects. So, again, foundationally, we'd really like people to get into those good habits instead of, again, depending on something. But there'll be these things that come up and all, and it's hard then to get because people want a quick fix. And again, I don't blame them, but it's if when you get the evidence, that's what's really convincing. And
I
you mentioned the
completely agree.
resource too. We have a website, mayoclinic.org, and it's a very powerful search engine. So if you just want to search on fitness, if you want to search on aerobic conditioning, like I say, strength training, the videos, flexibility, all that sort of stuff, it's on there. So again, I think good evidence-based information is helpful because I think that gives us a grounding and why we're doing what we're doing. And I think the more we get that, again, like I said, the 800 times effect of physical activity, that's not some of these studies. Oh, we're trying to make it. Well, we're trying to make it work, and we're trying to see if it's effective. This is effective. It's effective. Been effective for the history of mankind, and it will be in the future. So let's not overlook those foundational basics.
Well, the goal of this episode, if there was one, was to just reconnect with that why to exercise, and I think we've done that, and I'm sure our listeners will really enjoy this episode for sure. I always know it's a good episode when whatever it is we're speaking about, I want to immediately go and do. So I will be going on a run after this
All
podcast,
right.
and I wasn't planning on before. So
Excellent.
thanks so much for your time. Really enjoyed that, and thanks again for coming on.
My pleasure, Ben. Thank you for the invitation. And motion is lotion.